My name is Peter Macdonald. I'm the president of Australian Doctors International. I'm also a medical practitioner and I work in remote parts of Australia. Great love is Australian Doctors International, which essentially it aims to improve health outcomes in Papua New Guinea through the deployment of volunteer health staff. Has evolved as an organisation from being one that has initially focused on treating individual patients and seeing that as the outcome or the goal, to one that recognises that unless you undertake broader activities in terms of bringing about change, both in a public health sense but also in a health administration sense, you're really not bringing about sustainable change. So in my address in October, I want to try and highlight that process of where one moves from seeing the role of a health charity as being that of treating individuals and saving lives, so to speak, to one that takes on a broader role. And there are examples. For instance, one of the great ravages in terms of diseases in PNG is TB. It's poorly managed because of a number of issues. It's been said that good management of TB is a proxy for effective health facilities. And that is absolutely true. Now, so we're doing more than just treating the TB patient. We're trying to treat the system. ADI is trying to take a holistic view of where the problems are, not just at an individual level, but at the systemic level. Now, there's a number of examples that I'm intending to go through when I talk at the conference in October. But I'm trying to demonstrate this thinking that's going on within the organisation. I think it will appeal to the professional audience that I'll be talking to. I want to try and characterise this scenario of where we've moved beyond addressing the individual, but moving to try and bring about an improvement in the system. And this is particularly important in Papua New Guinea, where most of the institutions are pretty ineffective. I'm really delighted to have been invited to address the conference. I hope that we'll appeal to many of those doctors who may have thought to volunteer in somewhere like Papua New Guinea. Most of the doctors who we've deployed, we've come from rural settings. So I hope that the story I tell, I hope, will be interesting, and I hope also that it'll bring some interest for those who may wish to volunteer in Papua New Guinea.